Hi, everyone. Thank you for coming today. My name is Mary Beth Walker. I'm the Vice President of Marketing, Government Relations, and Public Relations at Trillium Health. Today, we are very excited to announce a $750,000 investment in emergency housing assistance for low-income individuals who are living with HIV in Rochester and the Finger Lakes. This funding was secured through the efforts of Assemblymember Harry Bronson and Assemblymember Meeks. We are extremely grateful for their support. We would also like to thank our partners at Vocal New York, who are incredible advocates for people who are living with HIV. This funding will help to support two of our existing programs, the HOPA grant and the eShy grant, which are both existing programs providing housing assistance for people living with HIV. And now I'd like to introduce our first speaker. He's the chair of the Assembly Labor Committee and a lifelong advocate for social justice, healthcare access, and the LGBTQ+ community, Assemblymember Harry Bronson.
Thank you, Mary Beth. So, boy, I didn't think we'd get here to this moment, but it's been a long journey, a journey that started in 2016. And, you know, this is just a small step forward. $750,000, small step, but still a small step. I want to thank Assemblymember Meeks for his tireless efforts in getting HIV housing and fighting for rest of state. I want to thank Vocal New York for all of your work and advocacy, and Trillium for all of your advocacy and work too. So many of us have been fighting for what we call rest of state. And what that is recognizing the disparity that in New York City, if you're impoverished and you're living with HIV, then you have access to a housing voucher where you will not pay more than 30% of your income for your housing needs. The rest of the state doesn't have that program, and it's because of a quirkiness in the language in New York state law that allows social service districts to opt in versus mandating that they provide the services. So when that was enacted, the only social service district that opted in was New York City. And we've been fighting to change that and mandate it. We weren't able to get that through the budget, but that doesn't mean we're not going to stop fighting for it. We will. But we got a really big win for Rochester, New York. We got a really big win because we received $750,000 of state funds to expand the housing programs that Trillium have already been doing. But they need more money to help with emergency housing for people living with HIV. And this will allow them to serve more people and expand their program. And that's vitally necessary. As I've mentioned many times when I've spoke about HIV, I lived through the epidemic. Many of my friends aren't here anymore because they died of AIDS in the early 80s and early 90s. I fight for this in honoring their lives. I fight for this because we now know we're at a point where HIV can be a chronic, manageable illness. It's no longer a death sentence as it was in the early 80s and 90s. But to manage this illness, you have to stay on your medications. Daily, you have to stay on your medication. If you stop taking your medication, the virus mutates and then the medication is no longer effective for you. So we're asking people, stay on your medication, but if they don't have housing and they're sleeping on a park bench or they're couch hopping, how do they manage staying on and taking medication, most of them on a daily basis? So having the stability of housing is a key factor in making sure people stay on their medications and they're able to live with the virus and live with the chronic illness. But it's also more than that. If you stay on your medication and you become undetectable, then you cannot transmit the virus. You cannot transmit it if you're undetectable. So not only are we helping those individuals with the housing stay on their medication and be able to live a quality of life, we're also helping so that they don't prevent, or so that we prevent the transmission of the disease and the spread of the disease to other people. So this funding is about housing, but it's much more. This funding is about saving lives, and it's funding that will help us end the epidemic of HIV. So for that, I am so honored to be able to have secured this funding with Meeks, who was instrumental in securing this funding, so that here in Rochester, we're taking a step forward in saving lives and preventing the transmission of the virus. Thank you so much.
And now I'd like to introduce the representative from the 137th Assembly District, a champion for housing, education, workers' rights, and health equity, Assemblymember Meeks.
Thank you. Good morning. I just want to say thank you for being here this morning. Just want to thank Member Harry Bronson for helping lead the way in spearheading. They mentioned an advocate for social justice in the space of the LGBTQ, but I would say an advocate for social justice, for human rights, point blank, period, because he gets it. To Vocal New York, you all make our job a bit easier because you come with the energy. I remember plenty of days advocating on the $1 million staircase, putting the governor under pressure, the speaker, whoever, in order to get these things done. Trillium, we thank you all for the great work that you continue to do in this community. As it relates to advocating for the $750,000 for HIV housing, we recognize the challenges throughout our community and throughout New York State as well. For me, it's one of those things that I often find that there's these how do I call them? These false narratives, and these are things that we've dealt with as it relates to education in the HIV/AIDS space for some time. And when we look at the journeys, we've seen some major improvement. We've seen advances as it relates to the medications that's out there. But one of the things that we don't often talk about is the challenges that exist in Black and brown communities as it relates to getting this disease under control. And this is one of the things that we know will help, having quality housing for individuals who are dealing with HIV and AIDS in our community. An opportunity to know where they are, to meet them where they are, to provide them with the medications that they need, and also to provide them with education around this virus in which they're dealing with and in which they're fighting. As of today, there are over 100,000 HIV positive New Yorkers, with 2,500 unstably housed or homeless. Those numbers may not be 100% accurate. Reason being, there's a number of people who are in our community that may be HIV positive and not know that they're HIV positive. So at this time, we also want to highlight the need for individuals to go and get tested and know your status, because as Assemblymember Bronson stated, this is no longer a death sentence. There are resources out there. There are people in our community that love you as you are and that are ready and have resources to help you to be the better version of yourself. So I just want to say thank you all for your continued advocacy in this space, and thank you all to the media for recognizing this as news, and as newsworthy, and something that we want to highlight to the community and get the word out that there's resources here in Rochester, and we have resources to assist you. Thank you.
And now I'd like to introduce the leader with Vocal New York and a strong advocate for people living with HIV, Tracy Adams.
Thank you. My name is Tracy Adams, and I'm a leader for Vocal New York, which stands for Voices of Community Activists and Leaders, which is a grassroots statewide organization. And they're led by people that are directly impacted by the 4 unions that they cover, which is the Positive Leaders Union, the UU, the CRU, and I'm missing another union. Help me, HU, thank you. So, oh, I'm so sorry. Today is not a good day. All right, so I've been working hard with my comrades behind me trying to fight for this bill. I'm a person living with HIV. As of October 31st, which is Halloween, trick in the treat, I've been positive 24 years, undetectable. See, I don't live with HIV. HIV lives with me. HIV is not a death sentence. So today, thanks to Harry Bronson, thanks to Assemblymember Meeks, we got $750,000. So with this $750,000, I could bring my people home. And when I mean bring them home to housing so they could take their medication, so they could live and look like how I live at 62 years old. You know, we have been organizing this for more than 10 years to guarantee that HIV positive New Yorkers in Long Island and upstate have the same level of care and services that New York City has. Right now, people living with HIV in New York City already receive rent, transportation, and nutritional assistance. But every low-income New Yorker grappling with HIV and housing instability deserves unbiased access to secure, affordable housing, no matter what your zip code is, and no matter what the color of your skin is, and no matter what your race is and who you believe in. Housing's for everybody. HIV didn't go around and pick and choose who it wanted to live inside with. You understand? So anybody can contract the virus. But if you contract the virus, you can have housing. You're not going to die. You can have a home like everybody else standing out here with a refrigerator and a stove and a key to turn the door. Because when you're living on somebody's couch, you can still consider homeless. That is not my home. This allocation is a meaningful and historic step in our fight to eradicating homelessness among individuals with HIV in New York State. I am hopeful, confident, and happy that people in Rochester will receive the support they need because of this investment. And with this, Assemblymember Bronson, Assemblymember Meeks support, and everyone else here, we will continue fighting for this statewide so that people in Buffalo, Syracuse, Westchester, and everywhere else can receive this lifelong saving support. And before I say thank you, I would like to give my team their shirts from Vocal, because they worked hard and they always had their door open every time I went to Albany, being a pain. So thank you.
Okay, finally, it is my pleasure to introduce an exceptional leader on the Power List for LGBTQ plus business leaders, the Power 30 list for healthcare, and City and State's Above and Beyond Pride list. It's Trillium Health's President and CEO, Jason Barniket-Kearns.
Thank you. Thanks for being here today. As Mary Beth said, I'm Jason Barniket-Kearns, President and CEO of Trillium. Trillium Health was founded in 1989 as a HIV/AIDS clinic, serving patients during the height of the AIDS crisis. Over the years, we've expanded the services we do to become a comprehensive healthcare provider that offers both primary care, specialty care, and wraparound services. Today, we serve everybody in the community, regardless of their income, their sexual orientation, their gender identity, their race, their ethnicity. Today, we are serving over 17,000 patients and clients across the community. But we've remained true to our roots. And we're proud to be leading LGBTQ plus healthcare providing in Rochester, providing services to many patients that have been living with HIV for decades. We've come a long way. A positive HIV diagnosis is no longer a death sentence. People living with HIV can live long, healthy lives. People who remain undetectable with an undetectable viral load cannot transmit HIV. In other words, HIV treatment is HIV prevention as well. As others have said, studies have shown that people without safe, stable housing are unlikely to maintain their medication regimens. For example, if you're struggling to find a place to sleep at night, the last thing you're going to be worried about is taking your medication, getting your blood drawn, attending doctor's appointments. So secure housing is often the first step to regaining stability and reclaiming one's health. Trillium Health is deeply grateful to Assemblymember Bronson and Assemblymember Meeks for securing this $750,000 for emergency housing assistance. This will support low-income individuals living with HIV in the 9-county Finger Lakes region. This funding will be used as our homeless prevention funding for people living with HIV who are on the edge of homelessness. It will allow us to provide first month's rent, security deposits, emergency utility shut-off, back rent, and even transportation for housing searches. This funding will allow us to serve hundreds of people in the Rochester and the Finger Lakes region who are low-income individuals and have been diagnosed with HIV/AIDS. It will also prevent the spread of HIV and improve the overall health of our community. So Trillium Health is incredibly grateful to receive this funding, and we look forward to the day that we could really truly say we have ended the HIV epidemic. Thank you.